Le Nissan Kick-Split 2025 a beaucoup de plus. Apple CarPlay intégré pour jouer vos tunes préférées, des fonctions avancées de sécurité, un rendement énergétique remarquable, puis même la petite odeur de char neuf qu'on aime tant. Tout ça en plus pour moins. Le Nissan Kick Split 2025 est le véhicule neuf le plus abordable au Québec. Achetez-le à partir de seulement 22 774 $, incluant un rabais à l'achat comptant de 2 600 $. Profitez de cette offre avantageuse chez votre concessionnaire dès maintenant. Jusqu'au 2 mars, des conditions s'appliquent. Détails chez Nissan.
All right, welcome back to the Elias Makos show. Now, last year, when we were waiting for our baby boy to be born, he arrived in this world at the start of January. Any parent has gone through this, right? When they find out there's a pregnancy and that you've got a baby coming, you go and do ultrasounds at the hospital. You want to make sure the baby's doing okay. Well, this next story is quite something, a harrowing story about what happened to one baby. So have a listen to this. So a story of a baby who was saved before he was even born. The baby overcame a life-threatening heart tumor thanks to groundbreaking treatment at the Montreal Children's Hospital. The mother discovered during a routine ultrasound that her unborn child had a rare cardiac tumor. The prognosis was grim, but with the expertise of our next guest, a unique approach and medication typically reserved for transplant patients, well, that was used to save this life, marking a first in Quebec. Let's go to Dr. Tiscar Cavallé, joins us on the line. She's a pediatric cardiologist at the MUHC. Dr. Cavallé, welcome to the program.
Thank you so much. Thank you for having me.
So why don't you tell us about the discovery? What can you tell us about that moment this tumor was discovered?
Yeah, so this was a young mother, was a second pregnancy and went to her routine ultrasound at one of our partner hospitals within the McGill system, and there was a finding of a mass inside the heart of the baby. So this mass, it's very rare to have a tumor inside the heart of a baby. It's really less than 1 in 2,000 babies that will have that, and usually doesn't give any symptoms because it's small and you just find it in the ultrasound. But when we see a mass in the heart, we know that 50% of the time is a tumor in the muscle of the heart. That is not cancer, but it can grow very fast and cause trouble, and is frequently associated to a genetic condition that gives tumors in other parts of the body. But this baby mainly had the problem in the heart. And, what happened with the baby is that as we followed, we saw that this was getting bigger and bigger. At the beginning, wasn't causing any problems, but then we saw, it's almost filling out one of the pumping chambers of the heart. It's making a valve very leaky, and we were worried that the baby might die during the pregnancy or would need an open heart surgery immediately after birth. So these tumors sometimes have been treated after birth with this drug that you mentioned that is reserved for immunosuppression, so essentially preventing rejection from organ transplantation. But we know also that it has some anti-tumor properties, and it has been used in newborns or older patients to reduce tumors. At some point during the pregnancy, we were following this lady very closely, but we said, okay, we have to do something because now we're worried the baby could die even before it's, born, or you can also provoke an early delivery and try to do something after birth, but that comes with another combination of problems associated to prematurity. So what I did is I knew that it had been used postnatally, and so I surveyed all my colleagues in the whole country in Canada, and there was one group in Toronto that had some experience with this, so treating this before birth. So we together devised a protocol of how to treat the mother to shrink the tumor, and I just have to say that it's not just our cardiology team at the Montreal Children's Hospital that got involved in the case. You need, work with the obstetrician, with genetics that had to confirm that this was, in fact, that genetic mutation that goes with this tumor to be sure we were treating the the proper thing, right? Because, you cannot have a biopsy in a fetus. You cannot just remove the tumor from the baby and see what it is exactly under microscope. We also needed, the transplant pharmacist to help us treat the mother, because I'm a pediatrician. I don't know what to do with mothers and transplant medications. We also involved a neurologist and the neonatologist, so the newborn doctor that was going to treat the baby immediately after birth. So this is called the McGill Fetal and Diagnostic Treatment Group, that we were all together to provide the best care to babies and moms. So essentially, we started the medication around 22 weeks of pregnancy on the mother. And the problem with the medication is that it has side effects, so it can bring the blood sugar up for the mom. It can increase the amount of fat in the mother's blood. Also increases the platelets, which are the clotting cells, right? So there's a risk of clotting in the mom, which is already increased in pregnancy. Also, the blood cells, the white blood cells can go down, so you increase the risk of infection to the mom, especially during the viral season. That this can be a problem. And finally, the medication can also delay the healing of wounds. So we knew we had to stop it a few weeks before the delivery time, because otherwise the mother could have problems with that too. But we followed, the whole team got together. We worked as a group, and everybody did their part, and we managed to follow this patient on a weekly basis with me, with the transplant pharmacist. The mother had to have levels of the blood every week to make sure we were not overshooting or undershooting the level. So very, very close, intensive follow-up. And we were super happy because, 2 or 3 weeks after starting the medication, we already started to see that the mass was going down, getting smaller, to a point that we were not worried that this was going to be a problem anymore to the baby's life, to the heart functioning, and the baby actually was delivered normally and was perfectly fine after birth.
And how's the baby? Before I have to let you go, how's the baby doing now?
The baby is doing great. From the heart perspective, normal. Wow. He has this disease that goes with the tumor, and so has some seizures and things like that. This medication actually helped minimize. So it's been followed for that, but it's doing excellent. That we had babies before that have had open heart surgery at birth. They've been very, very sick, and this was a complete game changer. So we're very happy that we all work together for this. And
Dr. Cavallé, I imagine now you want to make sure the world hears about this, right? Do you think there could be other children that could be saved in a similar fashion?
Absolutely. And, these are the cases that we present at conferences, and we advertise to our own colleagues. We're a very small community in fetal cardiology in Canada, in North America. We all know each other. We all share cases, and we help each other so we can provide this treatment to every baby that needs it. Absolutely.
Dr. Cavallé, what a tremendous story. Congratulations on this success of this treatment, and thanks for sharing that story with our listeners. I appreciate it.
Thank you so much, and thank you for helping us advertise what can be done.
Yeah, more people should know just how incredible our science and medicine is. Thank you, doctor. That's Dr. Tiscar Cavallé, pediatric cardiologist at the MUHC.